next one we're going to go after is the Pec Minor. So the Pec Minor, Pectoralis minor, that's the name of the muscle, you have to actually basically pinch right here. So you can actually pinch this region to locate it. So the origin is actually second, third, and fourth ribs, and the insertion is a coracoid process, so right up in this region. So again, what you're going to do is you're going to pinch this area, and the major actions of it is actually protraction and also depression of the scapula, so it brings it down then. So those are the major actions. But for the Pec Minor, for the actual muscle, it's just going to refer just around this area. That's all it's going to do. But again, if it's actually like thoracic outlet syndrome, of course we can't diagnose, but it's actually going to go to the last two fingers here for the referral. So if you're pinching those areas and it's going to the last two fingers, you might be impinging the nerve in that region. So just make sure you back off. And so kind of the rule of thumb with trigger points, neuromuscular therapy, if it tingles more than 5 seconds, or if the pain is actually getting worse or it's not getting better after 10 seconds, might want to back off and just move off a little bit. So technically when you're holding a trigger point, it should start getting better after a few seconds. But if anything longer than that, then you might want to try a different technique or just move it just a little bit. So that's all it takes, is just moving it just a little bit, and then you can actually be a little bit more beneficial then. So I'm going to show you how to access the Pec Minor. So again, we're going to pinch here, and we're going to go underneath the Pec Major. So you're going to bring the arm over like this. So they're going to horizontally adduct then. You're just going to hold it then in that region then. So it's kind of a tricky muscle. It is possible to actually access it through the Pec Major, but if you want to actually get right to the Pec Minor, that's where you have to actually go underneath that region then. But when you go underneath that region, kind of slide on the anterior ribs, so don't go straight in and hold it. So the axillary region, so that you can actually cut off the circulation. So again, ask them where the referrals are, those kind of sensations, just to be safe then, okay? So again, you can bring it over and hold it. And you can even move the arm around a little bit too, just to make sure you got that exact spot then for the Pec Minor. But again, a lot of people just call it Pec Minor instead of Pectoralis minor. It's just a little bit easier to understand then. Okay, and the next one is the Pec Major. Pec Major, the origin is the medial half of the clavicle and sternum, and also costal cartilage of the ribs 1 through 6. And then the insertion is the lateral ridge of the bicipital groove. So right around here is actual insertion. So the origin is all this region here. So again, it kind of protects the pectoralis minor. So the pectoralis major, it actually is more superficial muscle right in here. So with these, it's a really good idea to ask the client where the actually areola is, or nipple region is, just to make sure you're not pushing on that region. So on women, it's a little bit more tender on the breast region. So any adipose, the technical name for fat, it's going to be more likely to bruise in that region when you're actually pushing down then. So there's actually many different trigger points, and most of them are just superior to the nipple region. So you're going to actually locate them like this, and again, if they don't feel comfortable with you palpating this region, you can use their fingers, so you can actually put a towel over that region to access that a little bit easier. And sometimes the towel is a little bit easier just because it's less likely to bruise, because there's a little bit more cushion in that region. So the actions, it actually adduction. So adduction, it actually brings it too close to like this. And also horizontal adduction, so it brings it straight over like this. And also medial rotation, so it's like this. And the reason why I have the hand up here is to show medial rotation. It's just because it's a little bit easier to see then. Because otherwise you can just have it like this and just rotate it, but sometimes people get confused with the forearm then. So that's why I just have it flexed a little bit and just perform medial rotation. And then also flexion of the humerus. So you want the arm totally at the side and just bring it straight up like this then, okay? So that's considered flexion right in that region. So again, with the pectoralis major, it can actually refer around the whole chest region. This can actually mimic heart attacks too, but of course if any client is really tight chest that just came on, of course you're going to send them right to the hospital right away just to be safe. So it can actually mimic difference in heart palpitations too. So there's many things that you can actually mimic right in here then, okay? So it's kind of hard to feel the muscle grain in a way, but also if you want, you can actually have them kind of resist you, try to push down, and so the muscle kind of sticks up at you a little bit too then when you're trying to locate the pectoralis major. So again, it's a little bit easier for a male to actually locate these, but for females too, it is beneficial, but it's really overlooked for the female population right in here then, okay? So still concentrate on those regions.